charming. Pet guru. Cat sleeps with mouth open. Is your cat sleeping position normal? Picture this, your cat, taking a nap, looking all cute and snug in different positions, sometimes like a little ball, or stretched out on her back, and even in that adorable loaf shape. And, oh, the places she picks for her naptime escapades. Whether it's snuggled up on your bed, making it her own cozy spot, or seeking tranquility in the bathtub. Now, let me describe a scenario. You stumble upon your cat in a deep sleep, mouth wide open. It's something you might have noticed in people, but when your cat does it, it adds a funny and endearing touch. So, you might be thinking, what's the deal with this quirky sleeping habit? What does it mean for your furry friend? Well, let me share a couple of reasons why your cat sleeps with mouth open. Let's dig into these explanations to uncover the mystery. Number 1, a totally relaxed cat. Have you ever noticed your cat peacefully snoozing with its mouth wide open? It might seem a bit odd, but don't worry, it's often a sign that your feline friend is feeling completely at ease and carefree. When a cat sleeps with its mouth open, it usually means that it's in a state of total relaxation, without a care in the world. Our kitten is likely enjoying a well-deserved night's rest after a busy day of play and exploration. Rest assured, there's nothing wrong with your furry companion. It's merely taking the time to recharge and gather energy for the next day of excitement. If you haven't observed any other unusual symptoms or behaviors, your cat is likely just thoroughly tired out from all the adventures. Interestingly, a super relaxed cat may even produce some loud snoring sounds. Yes, our cat might be a furry snorer. If you're curious about what this looks and sounds like, check out the video below to witness a contented cat in the midst of a peaceful nap, complete with adorable snores. It's a charming aspect of our cat's personality that adds to the uniqueness and joy of having a furry friend around. Number 2, feline cold. Cats, just like us humans, can catch a cold, and if my cat is snoozing with her mouth open, it might be a sign of this. She could be sleeping like this because she's dealing with a stuffy nose, making it a bit tricky for her to breathe normally while taking a nap. I've noticed a few other signs that could suggest my cat has a cold, like sneezing, watery eyes, a bit of coughing, seeming a bit tired, and sometimes even running a fever. These symptoms usually clear up on their own in about 7 to 10 days for most cats. But, in some cases, a cold can turn into more serious issues like pneumonia or a secondary bacterial infection. The most common culprits for cat colds are viral infections like feline herpes virus and feline calicivirus. If I suspect my cat has a cold, it's probably a good idea to take her to the vet for a thorough checkup. Generally, a simple cold doesn't need any special treatment, but there are a few things I can do to help my cat feel better. For example, if the air in my home is dry, using a humidifier can be beneficial. Also, I should make sure to provide my cat with a quiet and comfy space to rest, perhaps in a room filled with all her favorite things. In the case that my vet thinks my cat has a more severe cold, they might suggest antibiotics to help her recover. Number 3, allergies. If my cat has allergies, she might also sleep with her mouth open. Cats can be allergic to different things they breathe in, touch, or eat. If I notice my cat sleeping with her mouth open, it could be a sign of some environmental allergy, like fungi, dust, or mold. Even if someone smokes inside the house, the cigarette smoke can trigger allergy symptoms in my cat. Perfume and cleaning products are also potential allergens. Other signs that my cat might have allergies include runny eyes, sneezing, coughing, swollen paws, and excessive licking. To confirm if my cat has an allergy, the vet will need to perform a skin or blood test. If my cat has an environmental allergy, the easiest way to treat it is to ensure she avoids things that could cause an allergic reaction, like cleaning products, cigarette smoke, or strong perfumes. If necessary, the vet might prescribe medication for my cat, such as ointments, cortisone pills, or antihistamines. Explore more about managing environmental allergies in cats through our article on what can I use instead of cat litter. Number 4, dental problems. If my furry feline friend starts snoozing with her mouth agape, it might be a signal that she's dealing with some dental woes that need our attention. As cats grow older, usually between 5 to 10 years, they could start encountering dental issues, as hinted by insights from the cat teeth age chart. For kitties past the decade mark, it's not unusual for them to sport a gap or two in their smile, adding another layer to potential dental concerns. Aside from the noticeable habit of sleeping with her mouth open, a cat struggling with dental troubles might show other signs like persistent stinky breath, hesitance to munch on her meals, or even traces of blood around her mouth. These cues altogether underscore the importance of swiftly addressing any potential dental dilemmas. Spotting these signs nudges us to take our furry friend to the vet. A vet's know-how becomes invaluable in pinpointing the specific dental issues our cat might be grappling with and charting out the best course of action to ease her discomfort and enhance her overall dental hygiene. Regular dental checkups and preventive measures can significantly contribute to ensuring our cat's well-being as she gracefully ages. Number 5. Feline asthma. Sometimes, my cat might sleep with her mouth open, and feline asthma is one possible reason. About 1% to 5% of cats may be affected by this lower airway disease. Feline asthma makes it harder for air to move through my cat's airways, causing difficulties in breathing, as shared by the Cornell Feline Health Center. When my cat has trouble breathing, she might sleep with her mouth open. Other signs to watch for include fast breathing, wheezing, coughing, and even vomiting. To figure out if my cat has feline asthma, my vet will check her medical history and perform blood and allergy tests. Additionally, they might use an X-ray or CT scan to fully understand my cat's condition. Treatment for feline asthma involves medications like corticosteroids and bronchodilators, which can be given to my cat through inhalation, injection, or orally. While asthma in cats may not have a complete cure, with proper medication and regular monitoring, cats with this condition can still lead a long and joyful life. It's important for me to give my cat medications as prescribed and keep an eye out for any signs of health issues. Number 6. Jaw/joint problem. My cat is quite the adventurer, always making daring jumps and bold moves. Her lively lifestyle can sometimes lead to injuries. For instance, injuries to the temporomandibular joint at TMJ could result in luxation, causing my cat to sleep with her mouth open. She might also face issues like a dislocated jaw, a loose tooth, or joint pain after a playful bump or collision. These injuries could make my cat sleep with her mouth open, and they often come with other signs of discomfort, like a loss of appetite, lethargy, changes in litter use, and distinctive meowing. Number 7. Behavioral habit. Amidst the concerns mentioned earlier, my cat might simply have a behavioral habit of sleeping with her mouth open. For more insights into your cat's behaviors and habits, check out our guide on understanding your cat's behavior. Similar to how some cats snore or stick their tongue out during sleep, others might keep their mouth open. If it's a behavioral habit, I notice it as a regular part of my cat's routine. Even after a vet checkup, some cats may continue this habit for years, especially when they are relaxed during the day and, notably, during their sleep. How to keep cats from sleeping with their mouth open. Take care of their teeth. Make sure to give your cat regular dental checkups and professional teeth cleaning. If you see any problems with your cat's teeth, it's essential to have them checked by a professional. Fixing dental issues can stop your cat from sleeping with its mouth open. Cats should go for a dental checkup at least once a year, as recommended. Adjust the environment. Sometimes, the place where your cat sleeps might be too warm, making them sleep with their mouth open. If your cat pants during the day because of the heat, think about changing the room's temperature or moving your cat to a cooler place at bedtime. If your cat opens its mouth when feeling hot, you can also trim or shave its fur to help them adjust to the environment. Modify their diet and brushing routine. If dental problems are making your cat sleep with its mouth open, you can prevent more issues by changing its diet. Cut down on wet food and focus on a diet with mainly dry food, dental treats, and water. For cats prone to dental problems, try changing their brushing routine. Introduce brushing their teeth with a cat toothbrush or cat toothpaste. Teaching your cat to clean its teeth may take some time and effort. While some cats might resist at first, they often get used to it over time, making dental care a regular part of their habits. Consult a vet. If I've tried the methods mentioned earlier and my cat still sleeps with her mouth open, it's a good idea to visit a vet. The vet can examine my cat and suggest the best way to prevent the issue. As mentioned before, a common procedure to address dental problems is scaling. This process can make my kitty feel better during sleep. Medication. If the vet diagnoses health issues like asthma, they might prescribe medication to help my cat. Most cats with asthma show signs of respiratory distress, such as coughing, difficulty breathing, open-mouth panting, and more. The vet might provide my cat with an inhaler, also called a puffer, for asthma attacks. I need to make sure my cat gets the medication at the right time to ensure the treatment works effectively. Surgery. In cases where the cat's diagnosis reveals a severe health problem like a heart issue, my vet may recommend surgery. Detecting heart conditions in cats can be tricky because they're good at hiding their illness. Cats often don't show clear signs of heart disease until it's quite advanced. I should take good care of my cat during the healing process to ensure a speedy recovery. Conclusion. In conclusion, while occasional open-mouth sleeping might not be a cause for concern, persistent or new occurrences warrant attention. Regular veterinary checkups, addressing dental issues, adjusting the cat's environment, and following recommended treatments are crucial steps in ensuring the well-being of a cat that sleeps with its mouth open. Understanding the potential causes and seeking professional advice can contribute to maintaining a happy and healthy feline companion.